multifidus is the one I want to focus on the most. There's multifidus and then there's rotatories. The multifidus, well, they both go actually from the transverse process of one level up to the spinous process of another level. Right? They are between spinous and transverse processes. But they go up a couple levels at a time if it's the multifidus muscle. If it's the one that's the rotatories muscle, they just go from one level. All right? And so we don't really talk about those that much because the multifidus is so crucial. It's very crucial. Well, what it does, it extends and tilts the spine to the same side. It pulls on it. And it rotates it to the opposite side. But what it also does, it stabilizes spinal joints. And it's very, very important at doing so. Stabilizing those spinal joints. And so you can visualize that. And what happens is they're segmentally innervated. That means each level has a nerve going to it. So every level is very, very controllable by the brain. Not necessarily consciously, but posturally by the brain that has to deal with that. And what you see here is when you also see is about this level, down fairly low, when we look at this red stuff, a lot of this red stuff is actually multifidus. Not all of it, but a lot of it. You can see that here. These are the trigger points, by the way. But you can see that here. That's a lot of that is multifidus. And what you can see here, this is an interesting MRI. This is the same. This is a cross section through the body. You can visualize that.
Mm-hmm.
So that's
this part of the pelvis.
Yeah. Let me explain it a little. That's the back. That's the front. That's the belly muscles.
Okay.
So it's like you're cutting yourself to an up and lower level.
So this is all about the spine.
Right, the spine goes in and out. So you're looking like down onto the legs or onto the pelvis almost. Okay, so you're cutting yourself. It's cut about here though. It's cut about right above the pelvis. Okay, and so this is the vertebra here, and then this red stuff is the muscle. A lot of that is multifidus muscle. Okay, see, it's actually interesting because you can see the posterior, the back musculature, but then you see one that's in the side, in the middle, here.
Yep.
That's the quadratus lumborum. And then there is one in the front, and that's the psoas. And we're going to get to those as well, okay? But what this is interesting is this is a study from a medical doctor that shows the level of muscle function. Black, dark says function. White is fat, but not fat that means you're too fat. It's fat that means the muscle doesn't work. We don't need tissue that works. It's cheaper to keep that tissue than the dark tissue, the meat that works. And so this is what happens when we have pain or we've had pain before. Some of these muscles are really not working right. And that means the body cannot be controlled, the spine cannot be controlled on each level, and that makes it very, very vulnerable to get hurt. And so we can rebuild that, and I teach in my clinic to patients how to do that. And you just have a gym ball and you roll over it and you extend up your back or your chest. Of course, the thing is with these things, if they hurt, you don't do them by yourself. If they hurt, you always go and ask somebody or talk to somebody that knows what they're talking about. Okay?
Yep.
All right, let's go to a little bit more and then we're almost done. So we have a few more. We have to do breathing and then stomach.
Ooh.
So the breathing muscles are a few. We have the external intercostal, and then we have the internal intercostals, and then we get to the diaphragm. When we breathe, we have to also differentiate between silent breathing, which goes just as we sit here, we breathe in and out, or forced breathing.
Ah, yeah.
And so in silent breathing, the main inhalation muscle actually becomes the diaphragm, the muscle that's coming next. But also, we have the external intercostals that go from the inferior border of a rib to the superior border of the rib below. Okay? And what they do when they contract, they reach these, they pull the lower rib upward. Does that make sense? And so when they do that, they increase the volume of the whole lung because they collectively bring the lung outward and backward a little bit. And the lungs fill passively. The lungs are attached to the chest wall. And so what happens is when they're attached to the chest wall, air will just flow inward because there's a vacuum that gets created. And so that's how that works. And so we have the rib muscle, and then we see this one down here. That's that diaphragm. And the diaphragm reaches down as it contracts. And it flattens out, basically. And so that is the big muscle, together with the external intercostals, that help with the inspiration. Increase the lung volume.
Yep.
And then when we breathe out, breathing out is mostly passive. The internal intercostals, what they do is they attach to the superior border here on top of the rib below and reach up to the inferior border of the rib above. And when they contract, they compress the rib cage. They make it smaller, so they push the lungs out. I mean the air out. This is mostly more forced than the inspiration, but the internal intercostals still do its work and depress the ribs and decrease the lung volume, therefore. Interesting, huh?
Yeah, makes sense.
Good. The other breathing muscle is that diaphragm, and you see the diaphragm here. It's looks like a parachute.
Yeah.
Right? And it's attached. It's like its origin is a circle around the internal body wall of the trunk. See here, the rib cage and the costal cartilages, the xiphoid. So it goes all the way around here, and then it comes together into a central tendon, just a thickening in there. And so as it contracts, it pulls, this gets closer, it pulls together, so it pulls it downward. Right? So you see that here. As it contracts, the diaphragm is pink here, it goes downward. There's more lung volume, more air comes in. So that's inhalation. And then as it relaxes, it pushes back up like a parachute, and the air gets pushed out. And so that's very important, because many people don't use the diaphragm to breathe much. They do a lot of chest breathing.
Yeah.
And that's not good. We have that big muscle that we can help. So if you think you cannot breathe that well, if you have that problem, you can take a little book or something and put it on your belly and see it go up and down.
Yep.
And then you activate that breathing muscle. And so you can train yourself.
But you can also deep breathe in like mindfulness.
Well, yeah, mindfulness, we'll get to mindfulness. This is very, very important if you want to deep breathe and oxygenate your lung. It's very good to breathe in and count to like 3 or 4 or 5. And then breathe out. But breathe out and count a little bit longer. And then breathe in again. So you can be very mindful of your breathing, and that's a very good exercise to do. The more we are present with our body and our body functions, the happier we will ultimately be.
Yep.
I know, sounds weird, but that's the way it goes.
No.
Good. You're goofy dad. Okay, that brings us to the abdominal muscles, and hopefully that will bring us to the end. There, look at that. We're on slide 13 of 15, so good job listening. When we talk about the abdominal muscles, we have a few layers to it. And we have a few terms that come in here that are sort of new. We have one term here, it's called the linea alba. And the linea alba is like this thing in the middle that goes up and down in the middle, from the xiphoid process to the pubic symphysis. And then we also have these tendinous things here go across. These are tendinous inscriptions. And then we have this white stuff in here too. So it's kind of interesting. Actually, what happens is there's a sheath that goes around and envelops this middle muscle, and then anchors everything back to the other muscles and anchors it to the back. And see how it starts here in the back, this white thing here in the back? Mm-hmm. That's that lumbodorsal fascia down here. Yeah. And that's a deep membrane that anchors the deep muscles of the back of the trunk to the, ilium here, but also to the sacrum, and to the spinous, to the spine, lumbar spine. So that's kind of cool. The muscles that we have here to talk about are here, the first ones. It's not that first. This is the rectus abdominis. This is the six-pack muscle that everybody talks about. And we'll talk about that too, but not yet. We'll take that away.
That
then we
looks
have
like an 8-pack.
I know, doesn't it? Well, there is actually 4 levels. This is actually a bit of a wrong picture. We'll get to a better picture later. But what I liked about this is we have on one side here, we have these fibers going this direction. That's the external oblique muscle. And then on this side, we actually take that away and we have fibers. Actually, we have fibers here going this direction. These up here, this we take away. And this is the internal oblique muscles. So, but I like them here better because you can see the attachments. And it's not quite so clear, but I try my best. So when you see here, this is the external oblique. You see the origin is the anterior lateral border of the lower 8 ribs. Okay, and then more here. Wait, where is there more origin? Now it goes from here, and then it reaches into the anterior rectal sheath. And the rectal sheath is this white stuff that then envelops the rectus abdominis. So it anchors into that sheath in the front. Okay, and then the iliac crest, and on the bottom the pubic bone. So that's the external oblique. So when you actually look at that on the models, you just take your hand and put your hand into a pocket, and that's the fingers are the direction of the fibers of the external oblique. You can see that here, right? You can visualize that?
Yeah.
Good. And then the other one is the internal oblique. And the internal oblique has as its origin the iliac crest, and then reaches up to the costal cartilages of the lower of the rib 8 to 12 and the pubic crest, so to the bone. So it reaches upward and it reaches downward from the crest here. So it's kind of an interesting muscle that way, but it's almost like the fibers go in the opposite, in the perpendicular direction than these fibers. And you can just see how together, when they contract, how they're really strong. And then they can exert, like this can exert a force this direction very strongly. Or this can exert a force the opposite direction, with bringing the left shoulder here forward, right? You can see that?
Yeah.
Yeah. So that's these are very strong muscles. And then the deep to that, we have the transverse abdominus. And the transverse abdominus is actually visualized here very nicely. Just is basically wrapping the whole stomach contact around.
And that's like another view of that.
The rectus sheath
and the stomach that we were looking at the overview.
Yeah, exactly. If you're looking downward from here, that's where you see those things, exactly. And that's what you see here again.
Yeah.
See, here is those back muscles again, the multifidus, see here. And then here are these stomach muscles. We have the one on the outside, the external abdominal oblique, the internal oblique, and then the transverse abdominis is deep. It's like wrapping around it. But what it does is, see this arrow, it pulls the stomach content together. And that's why that's the real big important core muscle. Because what we want to do is core. We want to stabilize this trunk. See, in the gut, down in here, we have liquid. Up in the lungs, we have air. The liquid we've compressed, and then it gets really strong. Oops. The air, it just compresses and it pushes it out. That's not going to help. But the gut, if we contract that, that's really a strong stabilizing force. Because if that's not moving, if this part is not moving, we don't just protect the low spine. We also make everything we do with the legs and with the arms much stronger and firmer, because we have a strong trunk that it comes out of.
Yeah.
That makes sense? That's that core. And this is a very good way of building core. Don't do this if it hurts. This is pretty advanced.
So you
but
just
if
hold
you,
the plank,
well, you can hold.
You do like push-ups from there.
No, actually, yeah, you can hold it, but you can also walk yourself back and forward with the ball. That's why the ball's cool, because it rolls. So this is origin, the back of the muscle, costal cartilage, iliac crest, lumbosacral fascia, and then goes into the linea alba in the front, the pubic symphysis, and right in here. So this part. So it reaches around from the back to the front. All right? Good. Yeah, see, this is actually a very nice shot of the real core stuff. We have the diaphragm on top, the transverse abdominis, and then the pelvic muscle, floor muscles. That's why the ladies know about that. The Kegel exercises are important. Because all that compresses this whole trunk. And that's the last one we get to. All right, the rectus abdominis, and that's basically the six-pack muscle, or as you said, the eight-pack muscle. Goes from the pubic bone down in here and reaches up basically all the way into the ribs and the xiphoid process. Not just the xiphoid process, also the ribs a little bit to the side, because it goes a little lateral here on top. It flexes the trunk and it compresses the abdominal content. It helps the other muscles as well. But the interesting thing here is we have these tendinous inscriptions. And when you think about it, this muscle contracts as a unit. But each one, meaning as one nerve firing down and saying, hey, contract, you guys. Right? But each muscle contracts individually, meaning pulling from both sides on these tendons. That makes it very strong and very, very powerful. And so that's what that muscle does. All right? So that should get us a pretty decent understanding of the trunk muscles. And we'll go next to the upper and lower extremities. Any questions?
No. Very well said.
Well, thank you.